Welcome, everybody, to today's Lancet CUGH webinar series. I'm Dr. Keith Martin, the Executive Director of the Consortium of Universities for Global Health. And we have a fabulous webinar today. It's Building Your Career in Global Health and International Development. And we have three outstanding presenters who will each come to this challenge or opportunity from different perspectives. So we're very fortunate to have them. So the order in which we'll go in, I'll introduce them in a second. They will make presentations, and then after that, we're going to have a question and answer period where you'll have a chance to please send in your questions through the chat box on the lower right-hand corner of the presentation field. So without further ado, I'd like to say that our first speaker will be Dr. Sharon Rudy. Dr. Rudy has a long years of experience in this space. And Dr. Rudy is the Senior Global Health Director in the Public Health Institute. And after Dr. Rudy, we're very fortunate to have Dr. Catherine Chu. Dr. Chu is the Director of the Center for Global Surgery in Stellenbosch University in South Africa. And then after Dr. Chu, Dr. Miriam Sabin. Dr. Sabin is the Senior Editor for the Lancet, and she'll be our third speaker. Then we'll go back to question and answer. So it's my pleasure to hand over to Dr. Rudy. Dr. Rudy, over to you.
Hello, everyone, and thank you, Dr. Martin, for the privilege of being able to speak with our colleagues online. I want to identify myself just a little bit by saying that I've spent years working through Johns Hopkins University, focusing on social and behavior change communication, also working through the University of North Carolina, focusing on training and human performance technology. A number of those years were spent in Anglophone Africa. But the last 20 years, I've directed a series of global health fellowship programs. And so I have primarily an identity as an employer. I'm going to spend about 12 minutes talking to you about the employment landscape and trends, competencies that are important, and some questions for you regarding your own path. I wasn't sure who was going to be listening in, so I've focused on different audiences, high-income country professionals, lower and middle income country health professionals, and also students. I'm going to go through these slides relatively fast, but they will all be available to you through CUGH as well. I'm going to start with a really large question. What is global health? The most commonly used definition was created by Jeffrey Copeland and his colleagues, which really speaks to a kind of perspective and a value around the connection among all of us regarding our health. But for the purposes of your own career planning, I'd like for you to consider another way of looking at global health, and it is as a business model in which foreigners contribute resources to health activities in LMIC countries for a lot of different reasons. And the reason that's important is because it opens you up to really seeing all the players, not just the country Ministry of Health, which rightfully the country is running their own show, but there are many different organizations in play. Countries, companies, alliances, not-for-profits, NGOs, faith-based organizations, corporations, and all these people have their own agendas, their own purposes, and their own resources. I want to talk for a moment to students or people who are super early career in global health. You have a responsibility to choose the programs that help you prepare for the work that you want to do. And there are three career themes I want to illustrate for you. One is research, and that is, do you want to create new knowledge? The second is development. want to implementation? Do you want to implement interventions? And they can be the use of that new knowledge in any area: policy, training, systems. I was once the executive producer of the most popular radio soap opera in Tanzania. And then the third theme, career theme, is direct service. That's where you're actually seeing patients, seeing clients. Now, professionals in global health can do and often do all three, or they weave in and out. But what's important is that each of these areas takes a different skill set. And so when you're looking at programs, or if you're in a graduate program, think about what is it that you're mastering. If you want to be a researcher, but you're getting a lot of classes on project design, then look for another way of getting that information. What's more common is you want to be a development professional, but you're learning how to be a great researcher. And in that case, you want to look at curricula that might meet your needs outside of the core curricula. And for Americans, I want to give you a special message. You need overseas practical experience, and search for ways to get that. For LMIC, lower and middle income health professionals, I have a set of guidance I want to share with you based on my experience as an employer. Dr. Chu is going to go much more in depth in this focus area. But from my point of view, I want to tell you that recruitment primarily happens through professional networks and the internet. So focus on developing and using your professional networks. Also use social media. Have a LinkedIn, for example, which is the most commonly used website for recruiters. We pay extra money and we can do keyword searches. So what does your bio say? Will it pull you out of a search for a job that would be of interest to you? If you're in country, identify those donors that are in that country. Does the USAID have a mission there? Who is the health officer? Who are the Foreign Service nationals that have powerful positions in the USAID mission? Is there a UN system? Are there foundation offices? These are the donors. Who are they giving their resources to? Which organizations are doing the work that you're interested in? They're often NGOs, they can be corporations as well. Do informational interviews. People love to talk about themselves, so be curious about the work they're doing, attending conferences, and also presenting at conferences. A couple different pieces of advice regarding resume: 2 no's and a yes. Often from LMIC professionals, we will receive resumes that are dense paragraphs of narratives of your professional life. We're looking for ways to put the resume in the no pile because our job is to weed out and focus. Don't make it hard for us to see your skills and your gifts. Another no is don't have typos. Have somebody look at your resume. No, one misspelling can be enough to put your resume in the no pile. One yes is to have plenty of white space around your words. Make it attractive and easy to scan in 5 to 10 seconds. Another lesson I've learned in my experience is I've noticed that those LMIC health professionals that become project directors, vice presidents, CEOs in the global health environment are excellent cross-cultural mediators. They've learned to work in a bicultural environment, particularly around processes of decision-making and communication. So if that is a natural bent or a natural gift, really go deep with that and think about yourself working in this cross-cultural environment. For everyone, I want to share a study that we did a few years ago that was published in the Annals of Global Health, where we talked to almost 50 senior global health employers about their hiring practices. And we learned some interesting things. 85% of these employers agreed or strongly agreed that academia can and should do a better job of preparing students for what the work actually is. There's a couple different gaps that I want to point out because they're important competency areas as well. One is program design, management, and monitoring and evaluation of programs. So how you design a project, how you write a proposal, those are important areas and competencies to have. The other is communication, teamwork, collaboration, leadership, and supervision. These are interpersonal effectiveness areas. Employers believe that these are two large gaps in training that they then have to address once they hire you. The other thing I wanted to mention is just widen the gap, widen the access to LMIC experience if you are from a high-income country. So you are able to understand who those players are and what that life is like on the ground for an end user of whatever service is being provided. Now, there are some really great competency lists out there. I worked on a list that was published through the Consortium of Universities for Global Health that I'm very proud of. But as an employer, I have to make things really simple for myself. So I look at 4 different areas. We talked about interpersonal effectiveness and business skills already, but I want to mention the technical clinical topics and populations. This is always the lead on a job solicitation, and it will be a lead on your resume as well. This can cover all the universe of areas and the universe of special populations. This is one thing that employers felt that academia does really well, that prepares students for a depth in a technical area or a special population. I've added knowledge management because I consider it a key survival skill in global health. It's your ability to access what you need to know, when you need to know it. What are your key websites? How do you keep up on all these technical topics that you're an expert in? Are you reading Lancet? Who are your favorite websites? And I include in this the ability to manage your email systems as well, so that you can access what you need to know. The total sum of all human knowledge used to double, according to the RAND Corporation, every 400 years. Now it doubles every 6 months, and we're all buried in data. So your ability to manage that, to keep your head above the water, is really a key competency area. Now, what are we looking at in the future? This is a compilation of a number of surveys done by DevEx, DAI, USAID, WHO, the Gates Foundation. And it goes to a depth. One area would be a depth in specific health areas, including, and this is sort of adding on, chronic disease. And oh, look at this, what a surprise, pandemics and infectious disease. This, of course, is not going to go away. And then also key populations, in particular, gender and displaced persons. Evaluation, data analysis, and dissemination. This is probably the most stable technical area for a robust career. There isn't a project that doesn't need talent, but this is evolving, turbocharging these areas. Now we're looking at big data analysis, massive streams of data, and how to organize them, always starting with the quality of the initial collection. Business skills, which I've mentioned previously, proposal development. We did a study, we tracked recent grads for 6 months, and what they told us is that they wished that they had learned how to write a proposal for a project, because that's the thing that they were being asked for in terms of what their experience was. funding knowledge, all these business skills. This is why Americans who only have US-based experience get dinged by global health employers, because they don't think that you have enough information about how global health actually works. We also have these next two items also represent the future, and it's this idea that it's going to be health and blank, health and the environment, health and technology, health and water, etc. And so anybody who has the ability to foster collaboration among these sectors is going to be very popular. And as always, collaboration and teamwork skills are critical. But I want to say that the most important slide that I'm sharing with you right now is this idea that self-knowledge is the source of all wise career decisions. This is where you start. And my go-to career planning for the last 30 years has been a response to these 4 questions. And my answers have changed over time. What do you love? No one loves everything that they do all the time in their jobs, but notice and pay attention to when you're doing something that you just feel is you're in the zone, that you just love. What are you good at? It's not always the same as what you love. Where are the gifts? What are the gifts that God has given to you? And being aware, and this is not a moment for humility. This is, you've been given talents. What exactly are they? Where do you need to be geographically? Sometimes you need to be deep in the field. Sometimes you need to be in a HIC country. Where is it that you need to be? Where does your family need you to be? And then why global health? Always asking yourself, why this career and not another? I'd like to end by just giving you some specific programs that I'm personally involved in, because the Public Health Institute is a part of them. The first one is the STAR program. This is a cooperative agreement through USAID, and it over half of the fellowships, which are 2 to 4 year jobs, are LMIC professionals based in their countries or in another country. This is the Global Health Technical Professional Program, and notice this website. This is for early and mid-career professionals. And PHI also runs the Center for Disease Control's Global Health Fellowship Program, along with CUGH, which is a partner in both of these projects. And they are working on a global health security special fellowship program, as well as all the other technical areas that CDC is well known for. And this happens to be my personal email address, personal website. So with that, I thank you for your time. Thank you so much for listening to me, and I'm going to turn it over to Dr. Chu.
Thank you very much, Dr. Rudy, for that introduction. Good morning or good afternoon, depending on where in the world you are. As a way of introduction, I am a US trained doctor. I am a surgeon by trade. I have been working in Africa for about 15 years now. I started my global health career with Doctors Without Borders, which is a humanitarian aid agency. And I have been working in the mission field, and I've been working for several different governments in the public sector. And now I run a Center for Global Surgery in the Department of Global Health at Stellenbosch University. So I spend most of my time now training early career global health professionals. So I would like to spend my time talking about building a global health career for LMIC researchers, a view from the global south. So in global health, we talk a lot about inequities. We speak a lot about the worst health outcomes in LMICs. We talk about the paucity of funding for LMIC institutions. We hear about the lack of global health researchers in LMICs. And we certainly know about the inequities in global health academic partnerships between the global south and the global north. However, for LMIC researchers, this is an ideal time to become involved in global health. And why do I say that? Well, the field is saturated with global health academics from the global north, but they all need partners in the global south, and that could be you. And so if you're still an undergraduate or in medical school and you want to know how to obtain more global health training, I really encourage you to look in your own country to see if there are appropriate programs in global health. In South Africa, for example, we have several universities which offer global health training. For example, the University of Cape Town offers a master's in public health with a strong focus on global health equity. Stellenbosch University, where I work in the Department of Global Health, offers a master's in clinical epidemiology and a master's in health service research, both of which offer excellent global health training. If at all possible, I encourage you to obtain a PhD in global health. This can give you the skills and the expertise to further your career. And I think employers really take this seriously. Many African countries now are in a big push to promote more PhDs. South Africa, for example, has the South Africa PhD Project, which is a program in collaboration with the National Research Foundation to increase the number of PhDs to over 1,000 annually. In addition, there's a specific program for doctors to help them become clinician scientists. In South Africa, that's called the Bongani Mayosi National Health Scholars Program, but other African countries also offer this. In South Africa, the universities will offer African nationals, so Africans from outside of South Africa, partial or full funding for PhDs as well. If you live in a country where global health training is not possible in your local universities, you could consider online global health training. There are several educational platforms, such as Coursera, which offer courses in global health, and some of them are listed here. Many of them will waive their fees if you're only auditing the course and don't need the diploma or certificate. I did also want to mention that CUGH offers a fantastic global health education competency toolkit, which is essentially an entire online course in global health. And for each of the domains, they list first the competencies that will be covered in global health, and they also have a list of the online tools of where you can get free content. So there are online videos and direct you to other content. The first thing in order to establish yourself once you've got some training is to identify a global health topic that you feel is important or relevant to your community or country. If you're a clinician, you could identify a gap in service provision or barriers to care. Traditionally, global health researchers from LMICs have gotten involved in vertical global health priorities, such as infectious diseases like HIV, TB, or malaria. But just to mention now, horizontal global health priorities are really attracting the attention of funders. For example, topics in strengthening health systems, for example, in improving surgical care, and even multi-institutional collaborations to build LMIC research capacity has attracted attention of many funders. If at all possible, try to affiliate with an institution that has a grants management program. Ideally, that should be a university, but if that's not possible, some non-governmental organizations have also had experience already with grants. This is quite important because many big funders will not grant funding to organizations that do not have a grants management program. And very importantly, get a mentor or mentors. That can be either from a high-income country or an LMIC. There's very good data to show that academics are more successful in every measurement in their careers if they have mentors. This includes obtaining grant funding, publications, and promotions. If you identify someone that you would like them to be your mentor, be explicit in your asks. Your mentor will likely be extremely busy because they are very successful. And if you ask them to do something, please follow through. So if you send them an email and say, "Dear Dr. So-and-so, I very much admire your ability and your success in researching multi-drug resistant TB, and I would love to be mentored by you, even though I live in Cambodia and you live in Baltimore, and I would commit to contacting you once a month for an hour But make sure that if you ask them this, that you follow through. And it's important because this person could become a future research partner for you. There is earmarked funding for career development, specifically for LMI researchers, and there are many, but just to mention a few. In the US, the National Institute of Health, or the NIH, has a K43, which is called the Emerging Global Leader Award, and this is specifically for LMIC citizens. This is a 5-year funding mechanism. You do need a US mentor. Again, this is about building your career as an LMIC researcher. The UK has something similar from the Wellcome Trust. This is called the International Training Fellowships. And similarly, you need to be an LMIC national and have a PhD or be a clinician. It's also funded for 5 years. Specific international global health grants that are more about the research topic than the person also come from various different sources, but just a few to mention would be the US NIH. The Fogarty International Center has specific funding for LMIC projects, and these projects need to take place in an LMIC and often now need an LMIC collaborator. They can even be led by LMIC investigators as well. The UK, the National Institute of Health Research, has the Global Health Research Program, also funding for LMIC researchers or collaborators. And similarly, the UK Academy of Science has a Global Challenges Research Fund. Just a word about equity in collaborations. If you are an LMIC researcher, do not accept token authorship. If you find yourself on a grant or a paper initiated by a high-income collaborator, that's great, but ask or even demand to learn the skills that go with being an equal contributor. Please ask that capacity building skills such as biostats or writing courses be added to the grant so that you can learn these skills. So in conclusion, LMIC researchers are in a desirable position to become partners for high-income investigators. Establish yourself as an independent researcher and apply for the increasing number of career and project funding opportunities for global health for LMIC researchers. You know what is relevant for your government, so make sure you have your local research agenda. In global health, we talk a lot about health equity. We also must remember to achieve equity for researchers and LMICs. Thank you for your attention. I would like to now turn over to Dr. Sabin, who will give the last presentation.
Thank you very much, and it's wonderful to be here. And I also just wanted to acknowledge Lancet Global Health and CUGH, which is putting on these really useful webinars. So I'm pleased to be a panelist. So I'm going to talk to you a little bit more personally about my experience, and you're going to hear some echoes of the previous presentations in my own experience, and I hope you'll find that useful. In my case, it was a bit of a long and winding road. And I wanted to start with this idea that, you know, there wouldn't be any science at all without intuition. And, you know, Rita Levi-Montalcini was a Nobel laureate in medicine. So as important as intuition is and what you think is important to address in global health, it should always be grounded in knowledge and skills. And then you can really take off from there when you have all of those. They will lead you to where you want to go. In education, for example, you don't have to attend the world's top public health school. What's important, however, is, as you've heard, to take advantage of the connections in and out of school. And I can't stress that enough. Do some research, even if it's a small research project where you can design it from start to finish, meaning where you come up with the ideas for the study questions, you write the protocol, you have to go in front of human subjects review. You have to collect the data, do the data analysis, think through what are the practical implications in the setting that you're doing this work, and how could it potentially inform the policies and the society for which you're doing this work. That will carry you through your career. Apply what you learn also outside of the classroom. And here I'm just showing a picture that a child drew, a Guatemalan Mayan refugee child now 25 years ago when I collected this. This was part of a nested study within a larger epidemiologic study I did for my PhD of her parents' experiences of the Civil War in Guatemala. So if we look at skills, obtain the skills that match your aspirations also. And this might be a wide range of transferable skills. And I think transferable skills are critically important. Sharon talked a little bit about monitoring and evaluation, interpersonal effectiveness, as you recall. In addition to those, basic field epidemiology and analysis is really useful. Mixed quantitative and qualitative methods. You will find that many people don't have a qualitative background or vice versa, and this is very useful to have a little of both. Communication skills. We see this all the time now, that the people who are the most effective communication speakers, have taken training in that area. They've worked on it, and it's very helpful. Choose a topic or two of interest also for yourself and follow these avidly. This was also mentioned in a presentation, but for example, I have been just getting the table of contents sent to my email address for the last 10 or 15 years now for a number of medical and public health journals, and just scanning those for a little bit every week and maybe reading one article from each of those journals. After 10 years or 15 years of doing this, you really have a wonderful grasp on a whole wide range of topics that are useful. Go outside your comfort zone also and obtain the skills you need to succeed. If we think about motivation, it is very important also on that intuitive, interpersonal level. What are you passionate about? Now, of course, what you choose to study differs a bit in different countries, particularly if we say the doctoral level. In the US, I was fortunate because I was able to come up with my own project idea, but then of course I had to seek my own funding for that. Whereas in other countries, you may be doing a project for a professor and they already have funding. So there are a lot of risks and benefits to both. But the passion is still really important because that will get you through your work. Think about also, what are you not passionate about? What don't you want to do? If you're not sure, go out and get new experiences. Take the time. Work for a little while. You'll probably find that you'll be able to sift through what sort of environment you prefer over another. Do you need to go back to school for a PhD, for an MD, for a postdoc? Is it just some additional classes that might be useful? Do you want to make a difference? In my case, this was something I really thought about. I was working at more of a micro level, at an individual level. Originally I got a master's in social work. And I really, really enjoyed that. But at some point, I felt that I wanted to make a broader difference. I wanted to have an impact on policy and even policy at a global level. And again, there's toss-ups to both, but I think in global health, you need to think through that and see where you fit on that continuum. Make a plan also and really try to follow it. And most importantly, do not listen to the naysayers. For me, and maybe in some cases for women, this is really important. I can't tell you how many people told me, oh no, you can't go off to that site to do your doctoral work. It's too dangerous, or you shouldn't do this, or you shouldn't do that, or who are you to come up with a particular idea? I just disregarded it and kept going while continuing to learn and getting all the skills I possibly could. Next is just to give you a couple of examples The first is of sort of the global health, very focused expert who works on a very particular area of global health. These are people that that I personally know. The first one I'll call Elle. She received a PhD in virology from a state university in the US. She focused on serology and assays for HIV. She was really interested in that. And she was working with people who, had a role in global HIV diagnostics. So she made good connections there. She was able to get a job with the Clinton Health Access Initiative. She moved to HIV department after working for a number of years at CHI. So she's been there for 3 years and is now helping to lead WHO guidance in science and HIV. Another example is Kay. Kay came from another country to the US. She received an MD and then was accepted into the Epidemic Intelligence Service, EIS at CDC, where she focused only on global immunization. And she stayed in this area for 15 years. And in particular, she was looking at, measles. She was seconded about 4 years ago to WHO and is now the measles team lead. And of course, you know what a big problem we're having with measles right now in the world. And I'm very happy to have her behind the wheel helping to steer that. So in my case, my long and winding road, I was an English major in college, which probably was definitely very useful in coming to the Lancet. At a state US university. I got an MS in social work, but I did a research minor. I didn't even realize I was doing an epi study, but I did an epi study. I then practiced for 2 years in different settings. I worked for $150 a month at an NGO in Tunisia. And that was the year that coincidentally, sadly, the Rwandan genocide happened. And that was my intuition moment. What was happening with mental health among the survivors? We hear a lot about that now and about mental health among refugees and IDPs, but it wasn't being discussed then. It was a very nascent area. And I decided at that time I was going to go back and do a PhD there. And I did an epi study, but I linked right away to a mentor, a psychiatrist at the CDC, who is still now one of my, closest friends and still a mentor. I was in a faculty position for a while at that university, the University of Georgia in the US, but applied to EIS because I had that macro discussion with myself, as I was saying, and thought, I think I'd like to try to apply my skills more on a macro level. And fortunately, and this echoes what Sharon was saying, CDC needed to diversify their skill sets in EIS. They were looking for people who had some interpersonal effectiveness skills. Well, for example, I was coming from social work. I had a systems perspective. I had a bit of an understanding about how individuals work in their environments. I had the strong evaluation background and the M&E. So I had the epi, so I was able to sort of slide into other areas that might not have been as easy for others. I moved to Geneva about 12 years ago, and in that time, I have been so lucky to be able to work at WHO, UNAIDS, and the Global Fund in a partnership at WHO. And for me, it was always, even though I was there in Geneva in these settings, having an absolute blast, I was keeping my opportunities always open, volunteering, for example, the Bulletin for the World Health Organization, where I was an editorial advisor. I kept publishing papers. I kept reading those table of contents. And when I saw, and actually this was on LinkedIn, from the Lancet looking for a senior editor, they were looking for some of these transferable skills. It turned out global health, solid writing, and scientific skills. And I was able to move to this job. So remember also that your expertise is a big plus, and also the in-country experience. As the others were saying, more and more direct funding is going to research centers. These are great opportunities for you. Finally, we're seeing that this is happening more and more in LICs and LMICs. WHO and other agencies acknowledge that they must also increase all forms of diversity and seek out opportunities with organizations that have links to the global level. For example, if you're at an entry level, apply to be a WHO intern. I can't tell you how many I've met who have gone on to receive great opportunities within WHO and have jobs there now. So in short, I will leave it at that. Oops, and I've just lost my picture. I apologize. I was just saying thank you and sharing a picture from a wonderful meeting I attended with Africa CDC in Zambia. So thank you very much. And now over to you, Keith.
Thank you very much, Miriam, and thank you all for fabulous presentations. Your questions are coming in, those in the audience, so please keep sending them in and we'll get through as many as possible. The first question I'd like to pitch to Dr. Chu. Dr. Chu, the question is, should somebody complete an MPH in the Global South versus a high-income country?
That's a great question, and I think that it sort of depends. So I personally, again, I mentioned I did my training in the US, but I got my MPH at the London School of Hygiene and Tropical Medicine, another high-income country, but they had offered a master's in public health in developing countries. And I think that was back before the term global health sort of came to rise. I think if you can find a program that specifically focuses on global health, whether that's in a high-income country or an LMIC, I think either would be perfectly acceptable. I think for those of you that are from LMICs, usually the tuition in high-income countries can be prohibitable. And so staying in the LMIC and obtaining your MPH there, I think is very reasonable. Also, just to mention that specifically, for example, the MPH from the University of Cape Town focuses on diseases that are more common in LMICs. Some of the MPHs in the high-income countries focus on their public health systems. So I think either, as long as there's a focus on global health and health equity.
Thank you, Dr. Chu. Dr. Rudy, this question is for you, and it's a nice segue from Dr. Chu's response, and it really deals with non-medical areas. So the question is from Nicole: how do you, what kind of, do you need any different skills to work in areas like water and in the environment, and how do you market those skills in global health?
Nicole, that's a great question. The interesting thing about global health is it really is there's a large umbrella, and there are many technical areas that fit under global health. Over the years, we've hired engineers and lawyers and linguists and anthropologists and psychologists and information technology experts, besides the usual suspects of health-focused technical areas. I think like any technical area, you want to pay attention to the professional associations and the organizations where people that are doing these combinations are talking about their work. And I think you won't go wrong by paying attention to the big employers, because they're the ones that are going to be hiring, especially more and more, these combinations of technical skill sets. So just keep doing what you're doing in terms of the large the large popular websites like Indeed, DevX, that are posting all of this work, and then be active in your own professional association, whether it was the Department of Engineers or the Professional Association of Engineers or the Tanzanian Institute of Engineering, anything like that that helps you create a network of professionals is going to serve you in the end. Thank you.
Thank you, Dr. Rudy. Dr. Rabin, this question is for you, and I'm going to bundle a couple together because in the same area, and it really relates to somebody, advice for a mid-career person who wants to get back into global health. What advice can you give to somebody who wants to get into global health and is a mid-career professional? And in particular, also somebody who has been working in the non-communicable disease field, which has not achieved sufficient attention despite the huge impact it has on people's well-being. So can you give any advice to mid-career individuals?
Sure, thank you. Well, fortunately, and we are in the Sustainable Development Goals era. And what that really means is that we are working, we should be working to reduce silos across many different diseases and conditions. And of course, NCDs is one of those. And in fact, there are a lot of opportunities. I would say in every area now. It is not just HIV, TB, and malaria. And in fact, if you come from a part of public health or the social sciences that has not worked in those, that could even be to your advantage. So, for example, if you have some years of experience, you're mid-career, you have been working on diabetes, for example. I have found, and I certainly heard in numerous conversations when I was at the WHO, of the importance of having people who have worked in NCDs as being really important. And one of the things that has become crucial in organizations being fit for purpose in order to achieve the SDGs is really bringing folks like you that are being suggested into the work. So even if you have a background, you've just been working in your particular country, for example, in a certain area that has not been a very hot topic for a long time, do not be concerned about that, because I think your experience, and I would really focus on that in a cover letter or in an interview, is what is needed right now as the world slowly goes through this epidemiologic transition in many places towards a whole variety of diseases and social determinants for health.
Thank you, Dr. Sabin. Dr. Chu, this is a question from Chris, and Chris, he says his current global health department operates more as a study abroad program for most students. So how can they better design their program to reflect what is needed in global health for future global health professionals?
Yeah, that's a great question. And I think that, Chris's situation isn't too different from many programs in high income countries where the definition of a global health program is sort of a study abroad or a unilateral sending high income students to get overseas experience. And I think that now we're in an era where we're really moving more towards bilateral partnerships where, the high income and the low to middle income country institutions are partnering together to try and decide what skills can students from both sides learn. So from an educational standpoint, there are shared research interests. For example, the high income and low to middle income country students can work on together. Now, it might be still a fantasy world that students from LMICs can then go to the high income country as well to get that experience because of visa issues and because of financial issues. But I do think that rather than just having a specific study abroad program, I think now universities, specifically in the US, are being encouraged to have sort of long-term partnerships with LMIC University, a twinning, so to speak. And so there are long-term projects, research projects that are specifically defined by the LMIC partner that students can work on. So it's something that's more sustainable, and it's a research that's driven by the LMIC. So I guess if all his university has to offer at the moment is study abroad, then the best he can do, which is still very valuable, is to partake in that, but find out while he's there what could be a more sustainable partnership, and really ask colleagues on the ground, students there, the lecturers there, what do they want out of this partnership? So that's not just a one-way relationship.
Thank you, Dr. Chu. And Dr. Rudy, I'm going to bundle a couple of questions for you. one from Kushbu and the other from Abby. And they want to know what are the skills one should focus on for development professionals after doing their master's in global health. And can you also share some of the language competencies people ought to acquire?
Sure. The After a master's, what the research was telling us, and I'm thinking of the two studies, the employer study and also the recent grad study. And I want to say these are primarily we're looking at the big American donors, USAID, Gates, and that. The skill sets that needed to be bolstered were from an employer's point of view, was evidence of sophistication in the area of proposal development, project design, and implementation. That was really something that was requested and probed by employers. The other was evidence of skill in creating alliances and being a team member and organizing teams and that area. The other area that we were surprised, but when the recent grads reported back to us after 6 months of job hunting, is they were asked a lot about what software packages they were familiar with, what kind of analysis program, data analysis programs, and that sort of thing. So that we have fed all that feedback through CUGH back to academic programs to make sure they knew that this is part of the shift that's happening. The other sort of big thing, and this is a recurring theme in recruitment especially for American graduates, is the lack of overseas living and working experience. And so I remember a moment where I was interviewing a person who just received their doctorate in global health, who had not lived and worked overseas, and she was overqualified for a lot of positions because of her PhD, and she was underqualified for a lot of positions because she hadn't worked in the field. And it broke my heart, and it made me angry that this had happened to her. And so if you don't have overseas experience, and the employers will tell you that they look for that, they're biased about it, and if you don't have it, go get it. And there's a lot of different strategies you can use to get that if you don't have it. Thank you.
Thank you very much. Thank you, Dr. Rudy. Dr. Sabin, I'm going to telescope again a couple of questions because your questions are coming in a fantastic response. The first question is for somebody who has writing experience and skills. Can you provide any advice to somebody who is interested in exploring how they can use their writing skills? And then the second question from Christy Marie is, what's the best way to identify and contact a potential mentor? Over to you, Dr. Sabin.
Okay, great questions. So, the first on writing experience and skills. Well, first of all, congratulations, because it's great that you have them and great that you enjoy using them. And I would go back to something that Dr. Chu was saying, and I've seen this, so many times where students, or if you're just starting out in your career, are sometimes asked to write commentaries or work on manuscripts or even blog posts, whatever, for others, and don't receive any credit for that work. And in fact, and they might not think that it even is the kind of thing that should go on their CV. First of all, it absolutely should go on your CV, even if your name is not on any of those pieces. And you can just make that clear. And secondly, you have to definitely stand up for yourself if you're working for folks who, maybe it just hasn't occurred to them that you would really like to be able to get on a piece, have your name on that. That's really important, but also look for opportunities where you can do that. Suggest a piece you can write. Say, hey, or I've noticed a lot of organizations are on, for example, like, medium.com writing blogs. Have we thought about doing something like that? I'd love to write a piece. So really look for those opportunities, the gaps in where you are now, or even write something yourself. I mean, we receive pieces at the Lancet, and when I was a peer reviewer from folks who have been students or early in their careers, but they have an area that they think is important and compelling, and they want to try to share it in a peer review journal, and so send it off. So I would say that. The other, in regard to contacting a mentor, yeah, you do definitely need some intel to be able to know who might be someone to contact. So actually, in my case, I was fortunate. I had a great PhD advisor who made some suggestions for me about other, faculty members, people I would have never known, who I was able to reach out to in areas I was interested in. But I also contacted um, folks who did know someone or someone who did work at CDC to say, hey, this is what I'm interested in. Do you know of anybody who might, um, anyone who I could contact? And I have found almost always there is always a friendly, helpful person who would get back to me and say, hey, why don't you think about contacting this person? Or they send around a message, that was sent on my behalf. So it can be very difficult if you're somewhere very disconnected, but try to rely on the resources you have there to do some of the reaching out for you, because they already have some of that, credibility that they can bring when they write to potential mentors for you. Thanks.
Thank you, Dr. Sabin. We're going to go 5 minutes over because there are a lot of really good, important questions that are coming in. So we'll take a little license here. Dr. Rudy, this question is from Pallavi, and Pallavi wants to know, how would you assess if pursuing a PhD is right for you if you've already completed terminal degrees like an MD or a DVM?
Thanks, Pallavi. That's a really good question. I think I think that when you're planning your career, you want to make decisions about academic degrees from a very strategic point of view. To pursue an MD degree, it's a tremendous commitment. It's years of focus and overcoming many obstacles. But what that gives you is a perspective. And in global health, there is a certain level of respect. However, if you're an MD without the research experience or the programmatic experience which other degrees can give you, you're missing that as well. So you have to bring them all together. You don't need a PhD or an MD to have a full, successful global health career. It's not a requirement. It's not necessary. However, if you want an academic life, and if you want, and I want to echo what Dr. Chu had mentioned, if you want a deep research capacity, then those degrees will help provide that for you, give you those opportunities. Thank you.
Thank you, Dr. Rudy. And I'm going to pitch this last, it's actually a double question, Dr. Chu, for you. And then we're going to finish with each of our presenters. Will have a minute to wrap up with some final comments starting in the reverse. So it'll be Dr. Sabin, Dr. Chu, and Dr. Rudy. So Dr. Chu, these two questions are When you coming from Stellenbosch University, where you're the director of the Center for Global Surgery, this question is: what would you suggest to build new programs where funding is available? How do you establish a solid infrastructure? Any advice on creating solid infrastructures, for example, in pediatric orthopedics? This comes from Gerald. And the other part of that question is, how do you get buy-in from academic institutions in the north to care about global health research or clinical work in the south, where it may not be profitable for them to do so? Thank you.
Thanks, Keith. So just to answer the first one is, how do you set up a program if you do have funding? I think the specific question was around pediatric orthopedics. I mean, I think you first need to build a team. So if you're talking about a low to middle income country, so oftentimes the clinicians there are already working on projects or seeing patients where they have an idea of what the gap is in research, and they can identify that. They themselves might not have those specific research skills or have that global health perspective, but there are often other folks at the same institution or at the university that might be linked to the hospital that do. If you're talking about a program in a high income country, and this might link to the second question, but if you're trying to set up a program in a high income country, then the first thing really to do is find LMIC partners. And so I think, as I mentioned in my talk, that there's a huge interest in global health, even from clinicians in high income countries, but they just need to find partners in LMICs. And to me, it's a bit like a dating game, because I think there are people on both sides wanting to be linked up. But oftentimes, if you're an LMIC, particularly if you're a clinician, for example, a pediatric orthopedic surgeon, seeing lots of cases, but you don't have the time or the ability to reach out and find out who on the other end would be interested in partnering with you, that has funding, has the team to build research, and to make it a global health collaboration. So I think it takes reaching out from both sides. Again, to find an LMIC partner, I think that's often a question I get from high income countries is, how do I do that, especially if they haven't published or written or reached out to anyone. I think the first is really to ask around. I think both the other two speakers were mentioning about networks, and I think in particular, there was a discussion about networks from other sectors, NGOs, the governments, some of the other in-country institutions or organizations such as CHI, the Global Fund, that may know some contacts of people already working in country. You could start there. And then the second question was, how do you get, sorry, Keith, was the second question, how do you get high-income countries to be interested in global health?
In the global south, particularly getting them invested in projects in the global south where it may not be profitable for them from a research or clinical perspective.
Yeah, that's also a great question. Well, I think more and more, the first answer is I think they are becoming interested. I think the number of people on this conference already suggests that there are people already interested in global health. But I think secondly, there are more funding opportunities for projects that link high-income researchers with projects and collaborators in the global south. So I think that helps a lot. And I think the third thing is that oftentimes certain diseases are more prevalent in the global south, but are also coming to the global north. And so traditionally, some global health research has started in the global south. For example, I mentioned HIV and TB, and because the patients are there and the morbidity is there. So oftentimes, I think we can sell it from that standpoint.
Great, thank you very much, Dr. Chu. That's fabulous. And so just want to, as I mentioned, we'll go in reverse, and all of our presenters will have a chance to give any closing comments. So we'll start with Dr. Sabin, then Dr. Chu, and finally with Dr. Rudy. Miriam, over to you.
Thank you. Well, this has been really a delightful discussion, and I've personally learned a lot too. One thing that I wanted to close on that I didn't mention, a skill that I think is useful for all of us in our careers and through our lives, is really learning how to accept criticism, learning how to listen to new ideas, learning how to write better if we're being told that our communication needs to be worked on, to be able to take a lot of critiques in different areas and skills that you may not be familiar with. That has also been very important, and I wanted to leave you all with that, and just to reiterate again, put yourself out there as much as you can. Get to know other folks, because you want to, because you're interested in what they're doing. From there, you very often will be able to have a volunteer opportunity or an opportunity to participate in something, even if it's attending a meeting or listening in on a phone call that you might not have been able to do. That can be really motivating for you and can also open opportunities for you. So I would really suggest that. And just to keep up all the good work and the interest that you all have in global health, because you're the important next leaders out there who are going to be leading the way. So thank you.
Thank you, Miriam, very much. And Catherine, over to you.
Thanks, Keith. I think the first comment is just addressed to the high-income students and researchers in the audience, is just to echo the importance of getting firsthand experience in low to middle income countries. So if you know your university has a study abroad program, that's fantastic. An exchange program, participate. If not, is it possible in your educational trajectory or early career trajectory to spend time working for an NGO, an organization in the global south? I think there is nothing that can, no classroom work can sort of trade off for that, to give you the legitimacy and for you to also understand if this is a field that's good for you. For me, for example, I started my interest in working abroad with Doctors Without Borders. I think before that, I really didn't have a clue as a surgeon what global health, public health was all about. And then the second thing is addressed to the low to middle income researchers. I think that, standing in your shoes, I think it is harder to break into the field of global health, but in some ways, as I mentioned in my talk, there's no time like the present. The whole world is now looking at us in the global south with interest because they need us as partners. And there aren't that many competitive global health researchers and career persons in the low to middle income countries. So if you can stand out, just want to emphasize the importance of being persistent, being professional. I really like the comments about the CV and making sure there are no spelling mistakes, to follow through, to be dependable. And I think then you will go very far. Yeah, thank you.
Thank you, Catherine. Now, Sharon, the last word is yours.
I want to reinforce what Dr. Sabin and Dr. Chu have said. Everything they've said is wise counsel to all of us. I want to double reinforce the importance in early career for HIC professionals to have that personal experience of the end user. It makes a difference when you're sitting in a policy-making position. I can see the difference of someone who is bringing into the conversation their deep understanding of what life is like in that LMIC country, in that village, in that city. The other thing I wanted to add is to, over the years, I've become aware of the power of the donor in setting the agenda, in focusing resources. And I want to invite you to consider a career in the donor community after you've had that personal experience of the end user, after you've done your significant work in the field. The donors need that depth and experience to educate their thinking about how they spend their money. And it comes into even the issue of academic partnerships. In our research on these academic partnerships, learning that whoever's providing that financial support can help equalize the relationships between the HIC and the LMIC partners. There's a lot of power in those possessions, and I invite you to be that influencer at that level. And with that, I'll turn it back to Dr. Martin.
Thank you very much, Dr. Rudy. And really, on behalf of all of us at CUGH, I'd like to thank Dr. Sharon Rudy, Dr. Catherine Chu, and Dr. Miriam Sabin for volunteering their time, lending their expertise to this webinar on building your career in global health and development. This webinar, like all our others, will be on our website at cugh.org. I would also draw your attention to other tools that you'll have if you look at the websites of all of our speakers, and also CUGH's website, cugh.org, where you'll see that competencies toolkit that was created by our education teams. Finally, I'd like to thank Jenna Smith for her excellent job in producing this webinar. I'd like to wish all of you a great day. Stay safe under the current environment, and we look forward to seeing you next time on a series of the Lancet CUGH Webinar Global Health Series. Have a wonderful day.
Thank you, Dr. Martin.
Thank you.